For millions of women, uterine fibroids can mean years of pain and symptoms that just completely disrupt their lives, often leading to major surgery. But what if that whole story is finally changing? Let's dive into some genuinely good news about a breakthrough in how we treat them. This is the big question, isn't it? It's the one so many women face when they get a diagnosis. You're dealing with all the symptoms, and then you're told that the main solution might be something like a hysterectomy. It's a really heavy question to face. And the answer, thankfully, is a clear and simple one. Not anymore. There's now a newer, really effective treatment available that doesn't involve going under the knife. Okay, so let's start with the solution first. This is a huge shift in how this condition is managed, and it gives women a powerful new option to take back control of their health. And to really understand why this is such a big deal, just look at this number. We're talking about an estimated 26 million women in the US alone who have uterine fibroids. This is not some rare condition. It's an incredibly common health issue affecting a massive part of the population. And this isn't some experimental idea on the horizon. As Dr. Elizabeth Stewart from the Mayo Clinic points out, we're talking about 2 new, officially FDA-approved medications. This is a real, legitimate, and accessible alternative to surgery that's available now. So, now that we know there's a new path forward, what exactly are we treating? Let's take a quick step back and make sure we're all on the same page. Okay, so put simply, uterine fibroids are growths that develop in the uterus. And the key word to remember here is benign. That means they are non-cancerous. They tend to be most common when women hit their 40s and early 50s, but even though they aren't cancerous, their impact can be seriously disruptive. And this is why. The symptoms can totally take over your life. We're talking about really heavy bleeding, periods that drag on for more than a week, a feeling of constant pressure or pain in your pelvis, even things like pain during sex or having to urinate all the time. This isn't just a minor inconvenience. For many, it's debilitating. Now, there's a really crucial point we have to talk about here. The burden of fibroids, well, it's not shared equally. There's a pretty significant health disparity at play. Just look at this data. It shows that Black women in the US are up to 3 times more likely to develop fibroids than white women. That's not a small difference. That is a staggering gap. And Dr. Stewart's research really underscores this point. It's not just that Black women are more likely to get them. They're also more likely to have more severe fibroids, and because of that, more severe symptoms. This just makes the need for effective, non-invasive treatments that much more urgent. So, how in the world do these new drugs actually work? How can a pill give the kind of relief that, until now, often required surgery? Let's break down the science, nice and simple. Okay, so these medications are a type of hormone therapy. First, what they do is block the specific hormones in your body that cause you to have a period. Think of it like just pressing a pause button. That then leads to the second step. They actually help reduce the size of the fibroids. So with smaller fibroids and no period, you get amazing relief from that awful heavy bleeding and pain. And the best part? It's been approved for use for up to 2 years, so it offers a real long-term way to manage symptoms. So, let's bring it all home. We have the science, but what does this all mean on a personal level? How does this breakthrough actually translate into a better quality of life? I think Dr. Stewart just says it perfectly here. It really is a game changer. The ability to just take a medication and get, as she says, terrific relief from symptoms that might have been controlling your life for years, that is a fundamental shift in how we approach this. And ultimately, that's what this all boils down to. This breakthrough is about empowerment. It's about having more choices on the table, so you can have a different, more collaborative conversation with your doctor, one that doesn't have to immediately jump to invasive surgery. Which leaves us with a really hopeful question to think about. With medical advances like these, are we actually moving toward a future where, for many women, managing uterine fibroids might not involve surgery at all? It's a future that all of a sudden feels a whole lot closer.